so many people here. And I'm honored also to be able to share this with you, because I think it's a pretty amazing thing that we have now in international law, and most people in our movement, particularly in the United States, don't really know about it at all. I think for many of us, as survivors of psychiatry, we feel the issue of forced treatment and involuntary admissions is really key. I know now in Connecticut, they're trying to introduce involuntary outpatient commitment, and Advocacy Unlimited is fighting against that. You know, both outpatient and inpatient commitment and forced treatment anywhere, many of us experience that as a really profound human rights violation. The way we created this treaty was really going from the lived experience of people with disabilities, including users and survivors of psychiatry, and saying, what are the violations we experience? What needs to be changed on a very overarching level in international human rights law to direct governments to change their own laws and practices so that the situation changes and we fully have our human rights. A lot of the peer support and peer advocacy work that we do can be thought about as support to exercise your legal capacity. The kinds of mental health alternatives that the movement usually would like, such as the Soteria programs, intentional peer support, which is also, of course, a peer run, you know, those can all be thought of in this vein. In the US, it's possible for judges to use human rights treaties as persuasive authority. There's a difference between mandatory and persuasive authority. The statutes, the Constitution, the precedents set in cases by that court or a higher court are mandatory authority. The court has to follow it. But the court can look at a human rights treaty. They can even look at the law in other countries as persuasive authority. Like this is a human rights treaty that the United States has signed, that was adopted by the UN General Assembly, which the United States is part of, that 151 countries have ratified, and we think it's a good idea. We think it's a good standard, and we're going to apply that in this court.